A student saw me after a long time and said, "Oh sir, you look the same even after 20 years, your body frame hasn't changed. What's the secret?" The secret is energy homeostasis. We will discuss energy homeostasis and the most critical factor, leptin, in this video. Another thing you might have noticed, there are many people who are on weight loss regimen. They want to reduce the obesity and fat mass. Initially, there is some amount of fat reduction, but it plateaus, and beyond a certain point, the weight reduction does not happen, the fat mass does not decrease. What's the reason? Again, the answer is same: energy homeostasis and the role of leptin. So let's understand this recently discovered ligand or chemical or hormone and its role in overall energy homeostasis and the body's frame maintenance. All right, so leptin is an important player in energy homeostasis and regulation of the body weight. It is released by adipocytes. One thing to be understood about the leptin is that almost exclusively it is released by the white fat cells or adipocytes. How does it work? When there is increase in the fat stores, there is increase in the circulating leptin levels. So more the fat mass or adipocytes, more will be the release of leptin. Circulating leptin levels will increase. Conversely, if there is a decreased fat store, if the fat stores decrease, then there would be a decrease in the levels of leptin. What is plasma half-life of leptin? It is 75 minutes. Now this point is to be noted. If you look at all the other protein hormones or peptide hormones, they have short half-lives, 2 minutes, 5 minutes, 10 minutes. So they are shorter acting. Leptin has got the half time in the plasma of about 75 minutes. It means, it indicates a fact, that is, leptin is a long-acting hormone. It acts on an intermediate to long-term basis and not on a very acute or short-term basis. Right. Where is the leptin receptor located? Leptin receptor, the LEPR, is in the arcuate nucleus of hypothalamus. So at this point, we have noted two things. One is leptin is released by the fat cells, then it circulates and reaches the hypothalamus, and the receptor for leptin is in the hypothalamus. It acts on the hypothalamic receptor. Precisely in the arcuate nucleus of the hypothalamus. All right. Leptin receptor is a tyrosine kinase associated receptor. Do you remember, do you recall any other hormone which has got this type of a receptor? Yes, the answer is growth hormone. So growth hormone, leptin, they have a similar receptor, tyrosine kinase associated receptor, that signals through JAK2 and STAT signaling pathway. JAK-STAT signaling pathway is also utilized by the growth hormone, and leptin uses the same pathway. So that's another fact about the leptin. Next, leptin inhibits the NPY cells. Now this neurons in the arcuate hypothalamus, arcuate nucleus of hypothalamus, they have NPY secreting cells, NPY, neuropeptide Y. Now this is concerned with the hunger and food intake. So leptin inhibits the NPY cells, thereby it will decrease the appetite, hunger and food intake, and it stimulates the POMC cells in the arcuate nucleus of hypothalamus. So by stimulating the POMC receptors or POMC neurons, it would stimulate the satiety. That means overall action of leptin is towards the suppression of appetite and stimulation of satiety. All right. Arcuate neurons also have insulin receptor. So here we will compare the action of insulin and the leptin. Both have receptors in the hypothalamus or arcuate nucleus of hypothalamus. But insulin is very short acting. I mean, you will see there are lots of variations in insulin levels throughout the day, and they are linked to the food intake or food deprivation. But that's not the case with leptin. Leptin levels do not change, or they do not show wide fluctuations through the day. And that goes to prove that leptin is acting on a long-term basis in the context of energy homeostasis. So leptin is an anorexigenic signal for the hypothalamus. It induces satiety. Stimulation of the POMC neurons. POMC stands for pro-opiomelanocortin. When these neurons are stimulated, then this POMC will be released and its cleavage products will be formed. And the important cleavage product is alpha MSH, melanocyte stimulating hormone. And along with that, CART, another neuropeptide, the CART, cocaine and amphetamine regulated transcript. Now this CART is released along with the MSH, and these two will induce the satiety. They will suppress the hunger and they will produce anorexia. So also energy expenditure via increased sympathetic discharge will be promoted by the leptin. So you see overall actions of leptin: when the fat mass is increased, then the feedback mechanism homeostasis says no more accumulation of fat. So it releases leptin, leptin works on the hypothalamus, and then the balance will be tilted towards energy expenditure. So less food intake and more energy expenditure, so that there is no more accumulation of fat mass in the body. Right. Inhibition of NPy neurons in the arcuate nucleus will suppress the release of NPy and another peptide, that is agouti related peptide, and then there would be reduced hunger, reduced appetite, reduced food intake, and more energy expenditure. That's the overall action of the leptin. Now the point to be noted, as I mentioned just now, acute changes in the food intake or fasting do not affect the leptin levels. Insulin levels though are altered dramatically in response to food intake through the day. So that's the difference between leptin and insulin. Although both are anorexigenic and both have receptors in the arcuate nucleus of hypothalamus, but leptin acts on a long-term basis. It's a long-term influencer of CNS feeding behavior. What are the physiological responses to low leptin levels? For instance, the fat mass has been reduced and the weight has been reduced. What happens next? Circulating leptin levels would be low, and then the physiological responses will be triggered by the hypothalamus. So there will be increased food intake. Yes, since fat mass has reduced, the body weight has reduced, it has to be regained to maintain the body frame, to maintain the energy homeostasis. So there would be increased food intake, decrease in the energy expenditure, decreased reproductive function, decreased body temperature. Naturally, if energy is being conserved, there is less of ATP breakdown, there will be less of heat production, and therefore body temperature will decrease, and increase in the parasympathetic activity. On the other hand, high leptin levels, as in the case of obesity, that would decrease the food intake, increase the energy expenditure. So the converse effects will be seen in the condition of obesity: decrease food intake, increase in the energy expenditure, and increase sympathetic activity, thereby increasing the energy expenditure. So in short, leptin is the hormone for the energy balance, for the energy homeostasis, and it maintains our body frame on a long-term basis. Or as I said, the other example, if somebody wants to lose the fat mass, obesity needs to be decreased, and they start the diet and exercise, etc. Initially, there would be a reduction in weight loss and fat mass, But then as the fat mass is decreased, there would be decreased leptin levels, circulating leptin levels will decrease, and then the body's tendency will again shift towards energy conservation and food intake. So that is the reason why beyond a certain point the body weight does not decrease any further. Is there any way that it can be maintained, the fat loss or body weight decrease can be maintained? Yes, there are secrets to that. We will talk about it in some other video. All right. Well, then the question that remains is, why is there obesity at all? If we have such a fantastic hormone that regulates our energy homeostasis and energy balance in a perfect way, then why do the people become obese? The moment the fat mass is gaining, there should be increased leptin levels, and it should prevent the further fat mass gain. Yes, that should have happened, but obese people have been shown to have resistance to the leptin action on the hypothalamus. That's the reason why there is obesity. So leptin levels are there. They are released by the fat cells, adipocytes, but the leptin receptor in the hypothalamus does not respond to this circulating leptin levels, and therefore it results in obesity. What is the role in the onset of puberty? Leptin has been found to have role in the onset of puberty, that body weight attains a certain level. When the body weight attains a certain level, and that too because of the fat accumulation, then there would be increase in the circulating leptin levels. Adiposity in the boys and girls at the age of 10, 12, 13, when adiposity has gained a certain level or certain mass, then leptin levels will increase, their action on the hypothalamus, and you know hypothalamus will have a pulsatile GnRH secretion at the time of puberty, and that results in the onset of puberty. So role of leptin has been found in the onset of puberty. In fact, it has been found that the obese kids might have precocious puberty as well because of the role of leptin in this. Okay, so it signals that there are, leptin now starts circulating, and it signals that there are sufficient energy stores to start the reproductive function. That is the logic behind it, that once a certain fat mass and body weight has been attained by the boys and girls, leptin will signal the hypothalamus now that they have attained a certain energy store to start the reproductive function, and that is how it goes. So obese children, as I mentioned, are known to have precocious puberty.